And Bernie came into my life at 4 months old with a comminuted severe fracture of his elbow. That's actually how I ended up with him. So he had to have a pretty invasive surgery that included a lag screw, 2 pins, and a plate to repair this. And he's done very well, but he's starting to get some arthritis in his elbow. Because of his age, he also started to develop some degenerative joint disease in his back here. He's got some arthritis in his hips and knees, sorry. So he is a great candidate for stem cell therapy and PRP. PRP stands for platelet-rich plasma. Platelet-rich plasma is basically the component of the blood minus the red blood cells. So we take the red blood cells out, and what's left is plasma that has all of these wonderful healing factors, and we're going to inject that into a bunch of areas. I'll get to that in a moment. In addition to that, there's new technology that enables us to harvest stem cells from Bernie without any surgical procedures. In the past, we had to rely on a surgical procedure where we removed some fat from this area of the body called the latissimus dorsi. We no longer need to do that. All we need is a simple blood draw, and from that blood draw, we're going to be able to send this off to a company called PrimoStem that is going to create stem cell and PRP samples that we're going to be able to treat Bernie with. The treatment's going to be multifaceted. We're going to start by injecting his joints directly, just under gentle sedation. It's not going to require any anesthesia at all. And then over his back here, we're going to put small gauge needles into acupuncture points and inject small amounts of stem cell and PRP solution into those regions. Lastly, we are going to give him an intravenous dose of stem cells and PRP, not PRP, but stem cells as well. I'll explain about stem cells very briefly. Stem cells basically are what are known as progenitor cells, which means that they have the ability to differentiate into any cell and tissue type in the body. That could be liver, that could be kidneys, that could be the joints in this case. The tissues of the joints, meaning cartilaginous tissue, ligaments, and what have you. And the net benefit of that is that those cells will seek damaged areas and actually regenerate them and give him long-term relief and much better longevity on these joints and help to heal his tissues. The PRP will give us a powerful anti-inflammatory effect, which will give us our short-term benefit, while the stem cells give us our long-term benefit. You're being a good boy, Bernie. So the process starts with a basic physical examination. I'm going to just gently feel along Bernie's back here, and you can see he kind of wants to drop as soon as I feel this thoracolumbar area. And if the camera was over his back, you would clearly see that he's got some muscle atrophy here associated with his issue. I'm also checking him neurologically, so when I flip those feet over, they should flip right back. They don't even think about that. It's an automatic reflex. If you see Bernie's a little slow on the left side, we call that a mild proprioceptive deficit. I'm also checking his reflexes to make sure they're intact. You can see Bernie's got a really nice reflex there. And he's got a little bit of diminished reflex on this side. So there's definitely some neurological signs on both sides of Bernie's limbs here. We definitely have some discomfort in the back, and we've known that for quite some time. Next thing I'm going to do is just try to extend his hips, and we can see we start to have some discomfort well before the full range of motion. We definitely have some osteoarthritis going on in that hip, and in this hip, that's about as far as we want to go. And when I'm palpating his knees, I can feel some very mild popping that we call crepitus, which tells me that he likely has some osteoarthritis of his knees. So in addition to the physical examination, we'll want to run some blood work on Bernie to make sure that systemically we don't have any issues. Namely, we're trying to do some cancer screening, because the one contraindication for stem cells is we want to do our due diligence to make sure there's no cancer, because stem cells could differentiate into cancer cells as well if they're present in the body. Bernie's already had a round of x-rays, so that's been done. That would be something for your pet that we would want to do in addition to this physical examination, some basic blood work, to get a look at the individual joints and the structures to see where we need to focus our treatment. Okay, so we can see Bernie's all ready for his blood draw. To make it nice and simple, both for our technician and also for Bernie's comfort, we just simply put an IV catheter in, and we're going to draw it right out of there. He's just going to lay here, and should be no issue whatsoever. You can see he's nice and cozy. We're just going to draw the sample and get it ready for send off. Okay, so I'm just gently holding off his vein here while Ingrid is pulling the sample. You can see it just gently flowing into our syringe, and Bernie is not even feeling it. So this is all we have to do. It's really remarkable that we went from needing a surgical procedure to get the sample to just a simple blood drop. You can see how uninvasive it is. Okay, so Bernie's joint is sterilely prepped. We've already injected his hip. We're going to inject his elbow where he's got the most arthritis. And I'm just going to palpate right here. My needle goes right in. So now I'm in the joint space. And in goes the PRP and stem cells. And voila, it's done, and he didn't feel a thing. Bernie had all of his affected joints injected, both knees, both hips, and his elbow. What I've done is I took little 25 gauge needles with hubs in them, and I put them along these points because Bernie has degenerative disc disease in his back. And what we're going to do is these are what are called acupuncture Hentagai points. We're going to infuse stem cells directly into these hubs, about 0.25 milliliters into each. And that'll complete his overall treatment today. And you can see how simply this is done. Just hook it up to the hub and inject. And Bernie's none the wiser. Just go on down the line here. Alright, go on to the next syringe. And if Bernie only had degenerative back disease, I could actually do this with him without sedation, because it's not painful. It's a form of what's known as aqua acupuncture. That's commonly done with saline in acupuncture practice, sometimes with B12. In this case, though, we're using stem cells, which takes it to a whole other level. Okay, one more syringe. Okay, so not only have we hit the acupuncture points, which would provide relief just with needles, now we've also infused stem cells, and then we just pull them out. You can see how tiny those needles are, and that's why this procedure could be done awake if necessary, with minimal discomfort.